A physician says check the labs on the patient in room 304. No name, no context, no medical record number. Can artificial intelligence figure out what they actually need? PhysAssistBench is the first benchmark to test exactly this scenario. Vague requests, ambiguous patients, and messy electronic health records all at once. Most medical artificial intelligence benchmarks treat clinical questions like textbook problems. Clean, well-defined, one right answer. But real physician assistance is messy. A colleague asks about a patient by room number only, with no additional context. The AI has to figure out who they mean, search for the right data, and deliver something genuinely useful. The benchmark draws from the Medical Information Mart for Intensive Care, a massive de-identified hospital database widely used in clinical artificial intelligence research. Each scenario pairs a vague physician request with a real patient record. The model must search through laboratory results, medications, imaging, and clinical notes to find what actually matters for that patient. What makes PhysAssistBench unique is layering 3 real-world clinical challenges at once. First, interpret a vague request from a colleague who barely explains themselves. Second, figure out which patient they mean on a busy ward with many similar cases. Third, navigate electronic health records to retrieve the actual answer. Previous benchmarks only tested these skills completely in isolation. The models cannot just generate answers from memory. They must call structured tools, querying laboratory databases, medication records, and clinical notes, exactly the way a resident navigates an electronic health record system. The benchmark evaluates both answer accuracy and the quality of the entire search and retrieval process that got the model there. The results are genuinely sobering. Top models handle simple clinical requests reasonably well, but when you layer vague language, ambiguous patient identification, and complex record navigation together, performance drops sharply. No current system consistently succeeds across all 3 challenges at once, revealing how far we remain from reliable clinical artificial intelligence assistance. The most dangerous failure mode is patient misidentification. The model retrieves data for the wrong person entirely. Many models also struggle with sequential tool use, making incorrect or unnecessary queries along the way. Even top performers show troubling inconsistency, succeeding on some cases while failing clinically similar ones, a pattern that undermines the trust clinicians need. PhysAssistBench, recognized as a top conference oral presentation, sets a new standard by testing what actually matters in hospitals. The honest conclusion: today's large language models are not ready for realistic clinical assistance. We need better reasoning under ambiguity, better tool integration, and benchmarks that genuinely reflect real hospital complexity.